Some of the health professionals leaving the continent are ending up in countries like the United Kingdom. That's because the National Health Service there is increasingly reliant on medical staff recruited from outside the UK and EU. And newly released data shows over 1,000 doctors and nurses from Ghana joined the country's medical register in the last year. Lakpe Olarinoye has more.
The National Health Service is struggling. Staff are continuously going on strike, and the United Kingdom remains a hotspot for medical migration from Africa.
Coming over and working in the UK is very appealing to many doctors and nurses in Ghana, simply because the pay is better. There is a support system here. There are actually ways to advance yourself in this country. And also, if we look at the situation back home, it's not great.
Ghana has become the latest African country to see an increase in overseas medical recruitment. And Dominic is one of the medics who chose to make that move.
Not everybody is from a well-to-do family. So once somebody completes school and then they have to wait 10 months to get their salary, that puts, some kind of this bad taste in their mouth when it comes to the work that they're doing.
But it's back home in Ghana where it's felt most. The continuous migration of medical staff is beginning to have a large knock-on effect on patients.
We are left in a situation where Ghanaian hospitals are failing. The infrastructure is poor. There is not enough money being pumped into the system. So people who are actually living in Ghana face great challenges. And I think that's an issue that we need to address.
Ghana is on the World Health Organization's list of 55 vulnerable countries. They all have low medical staff per head of population. In the UK, the Home Office holds what they refer to as their red list of countries to try to discourage systematic recruitment from these areas. But with an abundance of jobs adverts on social media, coupled with a dire economic situation, it means for many African medics, it becomes an enticing employment opportunity.
Despite its increasing reliance from overseas to fill vacancies and attempts to try to limit immigration, the UK government gave Ghana, Nigeria and Kenya $18 million to help boost their healthcare workforces.
If you don't really know the reason why they're leaving, it's really hard to direct that money. And I do think that giving them money is good, but I think that they need to do the added research to find out why they're leaving, and then that money can be targeted.
But with just one doctor to 1,000 people in Ghana and other West African countries, there are now growing calls for some of Africa's leaders to tackle the exodus of medical staff across the region. Lape Olarinoye, Africa Matters, London.